All right, this is Ashley Skaggs. This is my head to toe assessment, my ID. I'm gonna go ahead and have the patient walk in so I can check his mobility and his gait. And if you wanna scan the environment for me. And then come over here after you scan the environment and scan the thing over here. Right here. All right. So my name's Ashley. I'll be the nurse practitioner student doing your exam today. Do I have your consent to do the exam? And what's your name?
Skaggs.
All right. I'm just going to do a head to toe exam on you. Do you have any problem areas? No? All right. The first thing that I'm going to do is I looked at his gait whenever he walked in, his mobility. Good mobility. He was able to get around just fine. Good gait, good posture. He's well nourished. No skin issues, no lesions, no bruising that I note. I'm just going to feel your skin. Good skin temperature, nice and warm. No moisture noted. Good skin turgor, no tinting. Good coloration. Well, I did his vital signs before we started on the camera. His blood pressure was 110/78. His heart rate was 70. His pulse or his respirations were 12. His oxygen was 98%, and then his temperature was 97.9. All right, so I did my general inspection of you. I've already washed my hands. What I'm going to do is just feel your head first. So I'm just palpating to see if there's any masses or nodules here, and I don't feel anything. Do you have any tenderness on your scalp?
Nope.
And then looking at the hair, it looks appropriate, distributed well, normal cephalic. Ears are in good place on the sides of the head. No obvious drainage, no redness, no swelling to the ears, no trauma. I'm just going to feel, is there any tenderness to the ears?
Nope.
Okay. And then looking at the eyes, they're well placed in the center of the face. Sclera is nice and white. I'm going to pull down, and looking at the conjunctiva, it's nice and pink. Eyebrows are in good placement, appropriate hair distribution, same with the eyelashes. The nose, no obvious drainage, no swelling. On the outside, no trauma, nice in the middle of the face. And then mouth, no cracks, no swelling, no redness to the lips at all. What I'm going to do first is I'm just going to go ahead and look into your eyes. Just going to use my ophthalmoscope here. I'm going to check your pupil response first, and just looking to make sure that those pupils respond nicely, which they do. They're nice and round, reactive to light. Good. And I'm just going to have you kind of turn just a little bit this way so we can go to the camera. And I'm going to look into this eye first, and I'm just going to start at around 15 inches away. I see the red reflex. It is a nice yellowish pink. I'm looking at the vessels in there, no hemorrhages noted. The optic disc is a nice yellowish pink, sorry, but he does have a red reflex present. And then looking on this side, if you want to come over here, looking, red reflex is present. Optic disc is a nice yellowish pink. Looking at the vessels, no hemorrhages noted. Good structure of the eye noted there. All right. Next, what I'm going to do is look into the ears. I'm going to have you kind of turn your head this way. So looking into this ear here first, noting on the outside that there's no obvious drainage, no swelling to the canal, no redness noted on the outside of the ear. And we've already established there's no pain, so I'm going to look at the tympanic membrane. It's a nice pearly gray. I see the cone of light. I see the bony structures. No foreign objects noted into the ear. No drainage, no bleeding, no swelling noted in there. I'm going to do the other side. Doing the same thing here, looking at the canal first. No redness, no swelling, no obvious drainage. I'm looking inside. Tympanic membrane's nice pearly gray. I see the cone of light. I see the bony structures. And no fluid in this one. And no foreign objects, nothing into that ear as well. So those ears look good. Now I'm just going to look into the nose. So I'm going to have you tilt your head up. All right, looking at the septum, that is intact. Mucous membrane is nice and pink. No bleeding, no swelling. I see the turbinate in there. No foreign objects noted. Same thing on this side. Septum is intact. I see the turbinate. The mucosa is nice, pink, and moist. And no foreign objects, no swelling, any redness or anything like that in there. I'm going to have you occlude one nostril. And below. Good, on the other side. Good, so nice and patent on both sides. Now I'm gonna look into the mouth. Open. I'm gonna look at the hard palate and the soft palate at the buccal spaces on both sides there. The mucosa is nice and pink. I'm gonna have you stick your tongue out a little bit. Uvula is present in midline. His pharynx is nice and pink. No redness, swelling noted back there. He does not have any tonsils that I see at all. He must have those removed. And then his teeth are all there. I do not see any cavities. Can you stick your tongue in a little bit? In. No cavities on the bottom, but he does have braces on the top and the bottom of his teeth. All right. The next thing that I'm gonna do is just palpate for the sinuses. I'm gonna feel frontal sinuses, and you let me know if there's any pain here. Any pain?
Nope.
Sphenoid. Any pain there?
Nope.
Ethmoid. Any pain?
Nope.
And then maxillary. Any pain in any of those areas?
Nope.
So I checked on both sides in all 4 of those areas, and no pain and no swelling noted to any of those sides. Next thing I'm going to do is check the lymph nodes. So pre-auricular on both sides here, and let me know if there's any tenderness. Post-auricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular, infraclavicular, and then occipital. And I could do deep cervical on both sides as well, but I wouldn't feel anything. I can go ahead and try. Don't feel anything. So bilaterally on all of those sites, there was no hard lumps, no tenderness that he had noted, nothing red, swollen, or hot to touch or anything. So that's all of that. I'm gonna go ahead and check for for your TMJ. So if you wanna open your mouth. Good, and is there any pain when you do that? Okay, and I did not feel any crepitus. The TMJ feels really good. All right, the next thing that I'm gonna do is go through the cranial nerves. So cranial nerve number 1 is the olfactory nerve. To do this, we're gonna check the sense of smell. So I'm gonna have you close one of your nostrils and close your eyes and smell.
Coffee.
Okay, and then I'm gonna have you keep your eyes closed and close the other nostril.
Vicks.
Good, so sense of smell is intact. So that would be cranial nerve number 1 is intact. Cranial nerve number 2 is the optic nerve. This tests for vision acuity. So I'm going to have the Snellen chart here. I'm going to keep it back 6 feet. I'm going to have you cover one eye and read the lowest line that you can.
LTFPH.
And then switch eyes.
LTFPH.
Perfect. So that would be 20/20 vision in both the right and the left eye. So cranial nerve number 2 is intact. Cranial nerve number 3, 4, and 6 are the eye movement. So it would be ocular motor, trochlear, and then abducens. What I'm going to have you do is just follow my pin light with just your eyes. Good, so good movement there. I'm going to have you follow the pin light in with just your eyes. Good, so nice, good convergence. And then I'm going to have you look at the pin light, look off into the distance, and look back. Do it one more time. Good, so I'm looking for accommodation there. Now I'm going to look for nystagmus, so I want you to follow my hand all the way over to the side and just stare at my hand. I'm looking for any abnormal movements of the eyes, but his eyes are pretty steady, so no nystagmus noted there on this side. And no nystagmus noted on that side as well. So cranial nerve 3, 4, and 6 are all intact. The next thing that I'm going to check for is cranial nerve number 5, and that is the trigeminal nerve. So I'm going to have you sit your head up. First, I'm going to check for chewing or the masseter function, so just chew. Good, so I feel that on both sides there, and then chew again. And I feel that up here as well, so masseter function is intact on that. And then I'm also going to check your sensation, so close your eyes, and you're going to tell me if this is soft, dull, or sharp.
Soft. Dull. Soft. Sharp. Dull.
Good. So facial sensation is intact too, and that is cranial nerve number 5. Cranial nerve number 7 is the facial nerve. With that one, I'm going to have you puff out your cheeks, and then I'm going to have you smile, whistle, furrow your brow, and then raise your eyebrows. Good. So he has really good movement. So facial, the cranial nerve number 7, the facial nerve is intact as well. Cranial nerve number 8 is the vestibular cochlear nerve. I'm just going to check your hearing with that. So first I'm going to do the whisper test. If you want to cover this ear.
Cat. Dog.
Okay, and then the other side.
Car. Truck.
Good. So whisper test, he heard all of the words there. The next thing that I'm going to do is the Weber and Rhine test. So when I hit this, I want you to tell me if you can feel the same on both sides.
Yep.
And you can hear it both on both sides, okay? And then the next one is the Rhine test. I'm just going to hit it. You're going to tell me when you can no longer hear it, and then we'll check again in front of your ear.
Can't hear it.
Can you still hear it there? Okay. And then on the other side, we're going to have you turn your head this way a little bit. And then when you can no longer hear it.
Can't.
Can you still hear it there?
Mhm.
Okay. So the bone conduction is less than the ear conduction, which is what we want. So that cranial nerve number 8, vestibular cochlear, is intact. Cranial nerve number 9 is the glossopharyngeal. So for this one, I'm going to have the patient swallow. I'm going to feel the swallow on both sides. And then I'm also, while I'm here, going to go ahead and feel the thyroid. So if you want to take a little drink there. Good. So I can feel that on both sides there. He swallows really easily, no coughing, no choking with that. And then like I said, I'm going to also just go ahead and palpate the thyroid here as well if you want to take one more drink. Good. So the thyroid feels nice, not enlarged, no lumps or anything into the thyroid. Was there any pain with any of that? All right. So the next cranial nerve, that was cranial nerve number 9. Number 10 is the vagus nerve. So with that one, I'm just going to look at your uvula. I'm going to have you stick your tongue out. Say ah.
Ah.
Good. So the uvula moves up really nice and elevates with ah. And I want you to go ahead and cough. Good. So the cough reflex, or the cough is there as well. So the vagus nerve is intact. Number 11 is the spinal accessory nerve. With this one, I'm just going to go ahead and check to see if you can lift up on your shoulders with resistance. Good. And then I want you to open up your chin. So I'm checking that trapezius muscle there, and then the sternocleidomastoid muscle when he opens his chin. And if you could just move your head from side to side and then up and down. Okay, good. So cranial nerve number 11, which is the spinal accessory, is intact. Cranial nerve number 12 is the hypoglossal nerve. So I'm going to have you stick your tongue out. I'm looking for any deviation. There's no deviation of the tongue there that's noted. And I'm going to go ahead and also feel on both sides if you could press against. Good. So there's good strength within the tongue on both of those. So that cranial nerve is intact as well. All right, so all the cranial nerves are done. Now I'm just going to go ahead and do a quick inspection of your chest. What I'm going to do is just look and just see if he's nice and symmetrical with his breaths here. I'm also just going to go ahead and feel the chest. And he's got good movement on both sides there, nice and even and symmetrical. I'm just going to go ahead and just look at the chest, look at the color. I don't see any swelling, any redness. Do you have any pain when I touch anywhere on the chest? What about in the back? No pain or anything? And then I'm just going to go ahead while I'm here. I'm going to feel the angle of Louise here. It's just at that very most angle here. I'm just going to feel for any lifts, heaves, or thrills. And I do not feel any of those, and I can also inspect that as well. I do not see any thrills, heaves, or lifts. I'm also going to go ahead and look at the point of maximal impulse, which is midclavicular fifth intercostal space, and I'm just going to go ahead and feel that as well. He's got a good, nice, regular rhythm. Nothing abnormal felt there at all. I'm going to go ahead and just palpate your carotid artery since I'm here. So I'm just going to feel both carotid arteries one at a time. Feels nice and regular, like a 2+. And then I'm going to feel this side as well. Good, very nice and regular on both carotid arteries. Now I'm just going to go ahead and listen. I'm gonna listen to your carotid arteries first. If you'll just kind of hold your breath. Good, no bruise present on that side. I'm gonna do this side. No bruise present on that side as well. Now I'm just gonna go ahead and listen to the chest and your respiration. So if you'll take a nice big deep breath. And again. And again. And again. And again. And again. And again. One more time on the front. Good. I'm gonna listen to the back. So if you could come over this way just so that way the camera can see. There you go. So a nice big deep breath. Good. Again. 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 2 more times. And 1 more time. Good, so nice clear respirations. I did not hear any adventitious sounds on anterior or posterior bilaterally. No abnormal sounds there. Now I want you to go ahead and say E.
E.
Good.
E.
So I'm checking for agophony. The sounds still sound like E whenever I'm listening through the lungs. I'm going to go ahead while I'm back here and feel for tactile firmitus. So go ahead and say 99.
99.
99. One more time.
99.
So good vibrations felt throughout the chest whenever he's saying 99. So there's no crepitus or anything like that felt during the tactile firmitus. Now I'm going to go ahead and listen to the heart. I'm listening to aortic. Can you turn this way just a tiny bit? So I'm listening aortic. You can breathe normal. Pulmonic. Tricuspid. And mitral. Good. So I hear S1 and S2 on all those. No murmurs, no gallops, and no rubs or anything. So now I'm going to listen with the bell. Breathe normal. Aortic. Pulmonic. Tricuspid. And then mitral. Same thing, S1, S2 heard, no murmurs, no gallops, no rubs or anything on that one. The next thing that I'm gonna have you do is I'm gonna go ahead and have you lay back